si Secretary Concepcion said something about you explaining why the lockdown was needed to be done soon, no? And I just wonder if you can walk us through the discussions that basically changed the minds of the business community, no? Because it was like I mean, the protocols changed overnight, right? I mean, it was just one day before that we had announced GCQ was going to stay and so on and so forth. What happened there? How did you convince them?
Oh, ba't kayo pinapakinggan ni Secretary Concepcion? Nakamute ka yata, Prof.
Prof.
Unmute.
Prof,
first of all, I want to thank Secretary for listening to science. Secretary Concepcion, together with our mayors, their citizenship and leadership at that time really changed, brought consensus, to the IATF, and really, it's born not out of OCTA. OCTA is not important here. OCTA merely made a suggestion, but it was the recognition of all the stakeholders that if we go early, go hard, we will not just see in the fourth quarter, have a shorter lockdown, but will save lives. That's the most important thing. We did not want to have a repeat of the faux pas of March, where we were caught, where we lost effective control of the epidemic, and we not only lost the economy, we lost lives. And it's this passion to serve from the side of Secretary Concepcion and our mayors that drove them to the IATF to demand that we need to act now. And so this is, and the government listened. It's not listening to OCTA. It's not important where it came from. What's important, it's not important who is right, but what is right. And what's right is saving lives and livelihoods. And that was the basic argument. And the difference now is that the business sector, OCTA, and the local government leaders are all together. We see the problem, and so does government. And now with this strong consensus, with this call to work together, we're really hopeful that with the 2-week lockdown, we will be able to mitigate the worst impact of this evolving surge in COVID cases in the National Capital Region. So how we did it? We consulted, deliberation, consultation, the respect for science, the inclusiveness of the group of Secretary Concepcion and the mayors in the NCR. I think that was what that was important. And when we made the suggestion, we made it in front of Secretary Duque also and his chief consultant, and in front of the business community. We raised an argument that the lockdown is not a question of if, it's a question of when. Are we going to lock down later when we have 5,000 cases, or are we going to lock down now when we can save the economy and save more lives? It's simple.
Yes, sir. Sir, but I do remember there was quite a bit of resistance from several health officials to the proposals coming from OCTA. I'm wondering lang what the clincher was, kasi you're both proceeding from the same data, di ba? So science-wise, pareho po kayong pinaghuhugutan, pero medyo magkaiba ng interpretasyon. I'm wondering lang kung ano yung clincher doon sa deciding factor eh.
The basic disagreement of some of our colleagues who we deeply respect from the DOH, despite the fact that they rant on social media and completely behaving against established norms and practices of academics from the university we belong to. That being said, their basic argument is that we're alarmist. But the clincher here, as far as the IATF is concerned, was not even our own models. It was the model of the DOH that basically validated our argument. And that was the clincher. The alarm created by that model, which will be discussed tomorrow, is what validates the basic argument of OCTA. And it's not, again, it's not about OCTA, it's about us trying to face, and if I may be hyperbolic because there are a lot of writers here, the existential threat possibly brought by Delta. And this is not about us. This is not about who's better, who is epistemologically trespassing. It's about saving lives. There is a real serious surge, and it's going to cost us lives and livelihoods. And the government made a good judgment, by starting early and facing this together with all of us together. No, this is the first time that the business is with OCTA and the local governments are together. So I think this is good judgment call from government. Let's all help each other prevent this surge from further devastating lives and livelihoods.
All right.